All right, welcome back to the TheCivDiv. Today we're talking about nerve damage, a condition that affects millions of vets and definitely impacts us on a day-to-day basis. So if you enjoy this free information, please like and subscribe so we can continue to provide it to you guys for free. Without further ado, let's dive in.
Whiskey 9 Yankee 7 November Golf, over.
Nerve damage, also known as neuropathy, refers to an injury or dysfunction of the nerves. This damage occurs anywhere in the body and is often caused by physical trauma, exposure to toxins or chemicals, or certain medical conditions such as cancer or diabetes. Symptoms of nerve damage can vary, but often includes pain, numbness, tingling, and weakness in the affected areas. Now, severe cases can lead to loss of function. So you're talking about inability to actually use your hands, your feet, whatever the case may be, or even a numb patch on your body. So I just mentioned all of those causes. So we know that military service can be a significant risk factor for developing nerve damage due to physical demands, the hazards that we operate in. So veterans may experience nerve damage from trauma, from just getting out and getting after it during operations, exposure to chemicals like Agent Orange and other pesticides. And additionally, autoimmune diseases can play a big factor in the development of nerve damage, which is prevalent among vets and can also lead to massive damage throughout. Okay, so the VA rates nerve damage based on the severity of the symptoms and the specific nerves affected. In fact, there are over 60 different diagnostic codes for nerve damage. So you can see how prevalent it is among vets. So in order to keep this video short, we will talk about the three main categories under which nerve damage is rated, and then we'll go over some basic ratings that they will give you under those specific categories. So the first one is paralysis. This is the most severe form of nerve damage, and it can result in a rating from mild to complete paralysis, and basically it goes from 20 to 100%. So next is neuritis. This involves inflammation of the nerves and can include symptoms like tingling, numbness, and muscle atrophy. The ratings for severe neuritis can go up to 70%, but they have a few lowered ratings as well. The third way is neuralgia. This refers to nerve pain, which can be sharp and stabbing. It can be rated from 20% for moderate cases, or up to 40 if it affects a full arm or a full leg or a full limb of some sort. So just keep in mind, each type of nerve damage has a different diagnostic code, and the VA will use these codes to determine the appropriate rating based on the severity and the type of symptoms that you're exhibiting. There are several secondary conditions that are linked to nerve damage. These include depression and anxiety. I know every time there's pain involved, you can always kind of connect it to depression and anxiety, but it is true. The development of depression and anxiety is linked to pain a lot of times. So just keep that in mind as you are developing your claim. The next is musculoskeletal problems. Again, weakening of the joints, weakening of the muscles that are associated with that specific nerve damage. Last but not least, we have cardiovascular issues. So certain types of atomic nerves, definitely, if they're damaged, can affect your heart rate, your blood pressure, and different things like that make up your cardiovascular system. So those nerves can be affected just like any other nerves throughout it. So nerve damage is one of those things that is easily ignored depending on your symptoms. You need to be very crucial of your body, and any signs of unexplained weaknesses need to be documented. If you are anything like me, you ignore most everything that's happening in your body, short of blood coming out of places it shouldn't, passing out, or almost dying. But just remember, it isn't always about you, it's about your family. So In order to make sure your family is good to go, make sure that you're highlighting all the problems that you're having, especially if you're talking about waking up with numbness. My arms are falling asleep. I have restless leg syndrome. All these different things that are linked to nerve damage. Go get them checked out, get a formal diagnosis, get that linkage to your service, and get that claim in. Go get checked out, guys. All right, so enough on my soapbox. That is all I have for nerve damage. Hopefully this gives you kind of an idea of where to go or what to do as far as nerve damage, or at least the different types. But as always, this is Jay with TheCivDiv. Stay informed, stay resilient, and I will see you next time.